Hello and welcome to this video on how to use the new RTC 22D inline MDI adapters. So these adapters are be used in conjunction with medication profile M15 salbutamol. So whenever we need to ventilate a patient using a BVM or a patient that has an IGL, we are to use this device to administer salbutamol. So that's if a patient is having acute exacerbation of COPD or asthma, they're showing symptoms of dyspnea, respiratory stress, or where wheezing can be heard and bronchospasm is what is suspected. If a patient's in acute anaphylactic reaction, having trouble breathing, or even if a patient has known or suspected hyperkalemia, we can give salbutamol through this device as a temporizing measure when we can't get IV access to deal with the high levels of potassium in our patient. The nice benefit of this device as well is that if your patient is currently in cardiac arrest, and whether we have an IGL in or not, if we believe they are in cardiac arrest due to severe bronchospasm, we can now give salbutamol during that arrest. The device itself has two different outlets here. So one side has a 22-meter interior diameter inlet. So this is where our BVM actually hooks up to it. On the other side of the device, we have a 22-millimeter outer diameter. So this way it fits into our BVM masks. And it also has a 15-millimeter internal diameter. So that way it fits nicely and snug onto our iGels. The other part of this device that is very beneficial for us is this port adapter here called the canister activation port. So this is where we're actually going to put our MDI canister into the device so we can administer salbutamol. So the first step we're going to do, so you can see here we've got our adapters on. So we have our MDI adapter in between our filter and our mask on our BVM. So to use this device, we're going to take our salbutamol, we're going to take it, we're going to prime it. And then we are going to remove the canister from the MDI base. Next thing we're going to do is we're going to take our BVM. We're going to find our rubber cap on there. We're going to remove that rubber cap and we're going to insert our canister directly in there, ensuring it's properly seated. And at the beginning of every respirator device, we're going to push the device down to give medication. As you can see here, it's going to spray out, so 1 breath per spray. So make sure when you push the canister down, it's directly down. We don't do it at an angle, so that way we get full pressurization and a full dose of medication. Using an iGel, as you can see here, we're going to attach it to the iGel, but we want to make sure we're putting the correct end on. If we use the wrong end, it doesn't fit. So if you're finding that's an issue, flip it over. And again, it's got that 15-millimeter adapter that fits nicely on our iGel. We take our BVM, attach to the other side so our partner can keep ventilating while we're getting this set up. We take off the rubber cap, take our MDI canister that we've already primed, insert it like we did before, straight up, and we push straight up and down. So this is going to be a two-person job because there's going to be a breath and a puff for every single dose that is needed for this patient. Once completed, remove the canister, cover the rubber stopper back over top, and continue ventilating and repeat as required as per medication profile requirements. And that is the RTC 22D inline MDI adapter that we are going to be putting on our ambulances. As it says in the manufacturer's recommendations here, this is a single patient use device. So if you do use this on the patient, it is only to use that one patient. Once you are done with it, it is to be disposed of appropriately. Thank you very much.